All right, we'll move on then to the public comment. I have several folks signed up.
Thank you, Mayor and City Council, for allowing me to speak on this issue. We have a resolution that's coming up, and Councilor Phillips has brought this forward, is bringing this forward. And I would just like to say that this is an issue that is very dear to me. I have a lot of experience with people losing nearly everything by healthcare not being considered in this state, in this country, as a fundamental human right. Every other wealthy, industrialized, westernized nation takes it as given that healthcare is a human right. So internationally, we're an outlier.
Thank you, Councillor Phillips, for leading the initiative of the resolution to support healthcare for all Oregon. Even before this pandemic and the recession, there was ample data that healthcare in this country is an overly complicated and unnecessarily expensive system that propagates the racist, biased, and inequitable agendas that I would like to think are a mindset of the past, but have not been proven. They are still with us. The pandemic and the accompanying stress on our economy and our healthcare system has brought these pain points into even deeper focus. Our healthcare system is not broken. It is doing exactly what it was designed to do. It cares for those who can pay and widens the gap between us all and supports the net worth only of insurance companies. As a state and as a nation, we have everything that we need to move to a universal healthcare system and be in line with what the rest of the civilized world is doing. We have the ability to treat everyone in this state with unconditional respect and compassion. And we need local leaders like you who are brave enough to speak and throw you the weight of your opinions in assistance of a universal healthcare system for our state.
I'm presently, after providing employment for other people for 20 years, I am now grossly underinsured, working as a self-employed independent, sales rep, a part-time nursery production worker, and as a part-time respite caregiver. I've been rejected by OHP because my income fluctuates month to month, and I must report income monthly to be judged covered or not covered month to month. Meaning if I make a doctor's appointment, it's a complete crapshoot whether it will be covered or not. Paying premiums, I'm paying premiums, but then unable to afford the deductibles under the ACA marketplace. I am unable to qualify for disability due to a lack of diagnosis because I can't afford to be diagnosed. I don't actually want disability, just access to diagnosis and any ideas for possible treatment. As time has gone on, I've been forced to pay out of pocket for a multitude of substandard and even dangerous treatments. I've been forced to pay for appointments that resulted in zero diagnosis or treatment. They would look at me and say, yeah, that's weird. $600, please. Come back in 6 months and we'll look at you again. I've been forced to pay for bait and switch healthcare billing where the charges increased after repeated assurance by the provider of a lower quote. I've been forced to pay for pig in a poke services for which no one can tell me the cost ahead of treatment, even for something as straightforward as a toe x-ray. I am alarmed by the lack of professional accountability for and independent tracking of patient outcomes. And I'm also alarmed by the presence of extortion with regard to requiring payment for office visits in order to obtain prescription refills.
I just wanted to tell you that I too support this universal healthcare, or healthcare as a human right. I want to say that people of my generation and younger, we're not as afraid as maybe government workers right now of change. We're much more afraid that things are not going to change. Right now, I have to tell you, in Salem alone, I have witnessed at least twice people rejecting ambulances, people who needed healthcare very badly. But when the ambulance got there, they rejected the care because they know if they go to the hospital, they don't have any idea what the cost is going to be. They don't know if their insurance covers it, what little insurance they have. They're much more afraid of the system. What we have just does not serve the needs of the people. So I highly urge your support for healthcare as a human right.
Hello, my name is Valdez Bravo. Thank you so much for the opportunity to speak tonight. I'm here tonight as Vice President of Healthcare for All Oregon and providing testimony in support of the resolution to affirm healthcare as a human right and adopt the constitutional amendment. I hope City Council will vote for this resolution. As an Oregon native of Latinx and Standing Rock descent, Standing Rock Sioux descent, I was born at Oregon Health and Sciences University, OHSU, in 1977. Although my family lived in Salem, my mom lacked health care, and OHSU allowed her to access maternity services, knowing she lacked the ability to pay. 2 years later, with the establishment of the Chemawa Indian Health Service Center in my hometown, my family was able to access primary care and dental services at Chemawa, despite our inability to pay for health insurance. And as a child, I was able to get the care I needed at times early in my life when I was faced with health challenges that my folks might not otherwise have been able to afford to treat. At the age of 18, 3 weeks out of high school, I joined the U.S. Army in the hopes of adventure, learning a vocation, earning money for college, seeing the world, and serving the country that I love. I was fortunate enough to enlist as a medical equipment repairman, working in Army hospitals all over the world for 8 years, including with the 48th Combat Support Hospital in Afghanistan as part of Operation Enduring Freedom. And during these 8 years as an active duty soldier, I received high quality care from military physicians, nurses, and other care providers. Now, following my honorable discharge from the Army in 2003, I went back to work at OHSU. My life had come full circle. I felt a bit like a salmon returning to the place where I was born. 6 months later, I joined the Department of Veterans Affairs, and it's been an honor to serve my fellow veterans. Will probably continue my federal service, working in positions of increasing responsibility now as a Chief Operating Officer at the VA in Southern Oregon. And as I like to say, I'm not only an executive, but I'm also a client. I probably get my care, the best care anywhere, from the VA. Oftentimes, the only reason I had healthcare was because the government recognized healthcare as my right, whether it was because of my status and eligibility as a Native American, as an active duty soldier, or now as a veteran. The government has always ensured that I had the care I need to thrive. And I want to ensure that all of us have the healthcare we need to thrive, because I believe healthcare is a human right. I believe everyone should be able to access the care they need, regardless of their age, race, employment status, military service, zip code, or ability to pay. And that's why I support this resolution. And I hope that you all will join me in supporting it. Oregon has led the way in transformative healthcare reform across the years. When I was down at Baylor in Texas, earning my dual master's degree in healthcare administration and MBA, I was so proud when our faculty would highlight Oregon as a leader in medical marijuana, the Oregon Health Plan, Death with Dignity, and other advances in terms of forward-leaning healthcare innovations. This type of solution will help ensure that everyone has the healthcare that they need, and I hope that the City Council will join me in supporting it. Not only will this ensure from a moral standpoint, ensure that everyone we know, your neighbors, your loved ones, your family, your friends, the people at work, your church, your community, have the healthcare they need and won't be medically bankrupted because of it. It will eliminate vast amounts of waste in the system through our eliminating and potentially insurers as a payer. It'll rein in big pharmacy costs, the cost of big pharma. The VA has the ability to nationwide to negotiate its prices. And guess what? The VA pays the lowest prices for medications and pharmaceuticals of any healthcare deliverer in the country. It'll increase quality outcomes through proactive approach and providing preventative care to everyone. It won't be a luxury to get healthcare, and Oregon can and should lead the way. So thank you so much for hearing me. I hope you support the resolution to add healthcare as a human right into the Oregon Constitution, and to support any legislation on the state or federal level that makes it happen. Everybody in, nobody out. Valdez Bravo, Vice President, Healthcare for All Oregon. Thank you so much to Councilor Phillips for introducing this resolution, and may you all have a lovely night. Thank you.
Thank you, Mr. Bravo. Councilor Phillips.
Thank you. Just a quick comment to Mr. Bravo. Thank you, Valdez, for coming down tonight, and thank you for your continued service to our country, both in the military and in the VA system. I know my brother is a major in the Army Reserves, and he really depends on his VA care. I also want to express my gratitude to everybody who testified on behalf of this resolution. Thank you so much, Valdez, for coming down tonight.
Thank you all. Good to be in my hometown, even virtually. Love Salem. Jerry
Okay.
City all the way.
Anybody else got a question? We'll move then to special orders of business. 5A, Councilor Phillips.
Thank you, Mayor Bennett. So I am thrilled to introduce this motion. I move the motion introduced in the documents to a resolution declaring healthcare a fundamental right and supporting state and federal legislative action to achieve universal high-quality healthcare.
Second by Anderson. Okay, now, Councilor.
Thank you so much, Mayor Bennett. I really, as you can't tell, I'm really quite excited about this opportunity to testify or to submit this resolution in favor of declaring healthcare as a fundamental right. And I do remember what I wanted to say to Mr. Bravo, who spoke earlier, and to all of the people who submitted written or video testimony this evening, which is thank you. Especially to Healthcare for All Oregon, who I worked with, as well as many other community groups and individuals throughout Salem, to get what I think is a very strong resolution. As an emergency room doctor practicing healthcare in the busiest emergency room in the state of Oregon, I cannot tell you how many times I've seen people harmed by either the rationing of care or underinsurance or lack of coverage. I'm not saying that our system is foundationally flawed, but I think we all have to agree that we could do better. More people need better healthcare. And while some of the testimony tonight, was definitely very, very passionate, I'm not asking for any, specific fixes tonight, other than what's outlined in this resolution. I've tailored this to, speak to local things that are happening. So in the last legislative cycle, there was the passage of Senate Joint Resolution 12, which refers the question as a ballot initiative to the state of Oregon, which is that we'll be voting on whether or not we agree that healthcare is a fundamental right. And we're asking the city council weigh in on this, and that we take the position that people should vote yes. It's changed over the years since it was introduced by Representative Greenlick, I believe. In the past, we're saying a fundamental right as opposed to just saying it's a human right. And we're making sure that we don't take away from our other constitutional obligations like education. Beyond that, we're stating our support for the state of Oregon to continue their work through past legislation on achieving true, universal coverage. The reason why I think this is so timely is Oregon was above the average. We got to 94% coverage in the state, but as a result of the pandemic and other, things that are happening as social determinants of care, we've slipped a bit and we've gone down to 92 or less percent. So there's continued work that needs to be done. And then finally, we're asking our federal delegation to keep working on achieving things like waivers that would allow states like Oregon, who are doing things that are more local and cutting edge, to get to that true 100% coverage, so that they can continue without running afoul of the CMS and criteria that exist at the federal level. So this is tailored to be local. It's not a specific prescription for how to get there. This is not an endorsement of Medicare for all. I mean, I might be supportive of single payer individually, but that's not what I'm asking City Council to weigh in on. I'm just saying that we agree with the words, healthcare is a fundamental right, and that we keep working to be better as a state in terms of providing healthcare for everybody.
Great, thank you. Councilor, I had very good. I had a question about this. Does this take into account alternative medical models, chiropractic naturopathy, other kinds of care systems that may not be part of the Western medical model? Does this pick up those as part of the fundamental human right?
So it's an excellent question. And because of the broad language, it doesn't specifically include or exclude that. But I think you bring up an excellent point. And most systems that are being considered absolutely include those.
Okay.
Yeah. Beyond, healthcare in this country gets to be so arbitrary. I mean, the eyes, the hearing, dental care, these are all part of the human body, and yet they're not necessarily, standard included in healthcare. So I think, whether it's your point as to other, I'm a fan of allopathic medicine, but to other non-allopathic medicine options, I think that, more people need better healthcare. So it's an excellent point.
The other, and you hit right on it, is the other kinds of medical care. I know from my professional experience, one of the really common problems faced by children in school is dental. It isn't the broader health issue, it's the dental health can become really a barrier for kids at school. Does this pick up dental health as well as ophthalmological or optometric, all the rest of the?
So it's a great question. And it's my understanding that Healthcare for All Oregon agrees with you and with me is that their efforts would include those things.
Okay.
Again, we're not talking about Medicare for All tonight. That there's no chance to get there this year at the federal level. I'm just talking about local action. But when we talk about, Medicare for All, as activists, it means new and improved, which includes dental, vision, hearing, those things. But again, really, I'm just asking us to take the stance that we support voting for that state constitution amendment, sure, which is stating that healthcare is a fundamental right. It doesn't have the specific, how do we go to get there? But everybody working on it shares the opinion that, yes, it would include those things. That's great. I hadn't had a chance to read any of the bills involved, and I just wondered, I have watched over the years as the allopathic model has excluded so many other forms of healthcare. And I just wanted to find out kind of what your thinking is. It sounds really reasonable. Thank you. Councillor Hoy.
Thank you, Mr. Mayor. I just had a couple of quick comments. One of the comments I just wanted to address. Sometimes we're asked, why is the city weighing in on something like this? Why is City Council taking a position? And I think that I just want to say that in my opinion is it's important that we offer our opinion on certain things when it's of such universal import as something like healthcare. And certainly this impacts every resident, every person who works in Salem. And it also impacts the city fiscally. We pay a lot of money every year for health insurance for the employees of the city. And the fact that not everybody enjoys that kind of healthcare coverage is really, in my mind, in this country, it's criminal. I mean, for people, I shared with you all that during the last year I experienced Bell's palsy, and I'm still experiencing a little bit of the effects of it. But in the course of that, I've had the opportunity to talk with a lot of people about their treatment options and things. And you asked about some alternative medicines. And, I personally receive acupuncture every other week. And that's been a huge part of my recovery. But there are so many people I talk to who can't go to that because they can't afford it because it's not covered under their insurance. And the fact that I can get a treatment for my health that somebody else can't is just not right. And I'm really proud to support this. I hope everybody will, because I think it's the right thing to do and it's critical. Thank you.
Thank you, Councillor. Councillor Gonzalez.
I tend to vote in favor of this. I actually first became involved in healthcare discussions during President Obama's first term. I advocated for a better healthcare system locally, statewide, and went to DC twice, actually. Here's a couple of things that just sort of keep me up at night. I just sort of want to throw out now. First is I think we need to disconnect our healthcare from our employment. So can you imagine if we connected our car insurance payments to our employment? So I think that's one of the first things that we have to somehow get through. And then second of all, as I'm thinking about the costs, I'm just, as a small business guy, every line item counts. And when I look at this, I'm thinking, well, which of these costs can we rein in? Medicine, medications, I'm hoping. Salaries, who's going to take less? Are we going to be okay with a decent looking hospital and not just a fancy one? Are we okay with just something simple? Or when a doctor can't really tell us what's wrong with us, but we demand that they run every expensive test. No matter the cost. Those are the few things that I just keeps me up at night. But I do know that if we had good health care from birth, we would have what we want. So Thank you, Councilor Phillips, for bringing this to us, and but we have a lot of work to do.
Councilor Nordike.
Thank you, Mr. Mayor, and thank you, Councilor Phillips, for bringing this motion. Healthcare is a fundamental right. I fundamentally agree with that, wholeheartedly agree with that. And even though we have absolutely zero jurisdiction over public health, it matters that we as leaders speak up and demonstrate the need for this, because we have relationships with other leaders in the communities. The public health departments are run by the counties. They need to know that this is important. They need to hear it from everyone, other elected officials, all their constituents. The state of Oregon needs to hear that. We know that the state is finally prioritizing mental health as part of medical health, and I'm excited to see that. There is a huge amount of unmet need, and I don't think anyone can say it better than the testimonials we've already heard from people who signed up and had the courage to share their personal stories with us tonight. As someone who has volunteered in the camps at Wallace Marine and Cascade Gateway, I can tell you that lack of access to health care is a cause of homelessness. I have spoken to individuals who lost everything because when their medical bills got too high, they could not afford to keep a roof over their head. It is one of the causes out there. And unfortunately, there are so many people who are just one bad health event, one unexpected healthcare event away from losing everything. And in this country, that is appalling. It's completely unacceptable. So I'll be glad to support this motion. Thank you, Councilor Phillips.
Thank you very much. Councilor Stapleton.
Thank you. Yes, and very quickly, I just want to thank you, Councilor Phillips, for bringing this forward, and I intend to enthusiastically vote yes for this, and I echo all of the wonderful, beautiful things that have been said by fellow councilors.
Thank you. Councilor Lewis.
Real quickly, I too want to thank you, Councilor Phillips, for bringing this forward. When I think of fundamental rights, I think of the main three that this country is built on: life, liberty, and the pursuit of happiness. When I zero in on those, life to me means health. And certainly the pursuit of happiness. If you're not healthy, you should have the right to pursue that health. So I feel as though that we've had these rights ever since this country started. The practice is something that needs to be fixed. I don't know if I agree, Councilor Phillips, that the system is not flawed. I believe it is, and that's why we're here. And that's hopefully what we will get out of this in the near future here in Oregon, and eventually in the whole country.
Okay, thank you. Anyone else? Okay, if the recorder would please call the roll.
Councilor Phillips.
Enthusiastic, aye.
Councilor Leung.
Aye.
Councilor Gonzalez.
Aye.
Councilor Foy.
Aye.
Councilor Nordike.
Aye.
Councilor Lewis.
Aye.
Councilor Stapleton.
Aye.
Councilor Anderson.
Aye.
Mayor Bennett.
Aye. Motion passes.